Hello, my name is Andrew, and I'm an athletic trainer at a clinic called Faith in Motion. And today we're going to talk about common running injuries that we see here in the clinic pretty consistently. First condition we're going to talk about is our itis injuries or our overuse injuries. A lot of you have probably heard of tendonitis, and this is what we're talking about. So a lot of times what happens here is the load demands of the activity of running can be greater than the load tolerance of the muscles and the tendons, which causes irritation and inflammation of those tendons, which then leads to that tendonitis feeling. A lot of times what we see common place that we see it in runners is our plantar fascia, so the bottom of the foot. We can see it in the Achilles tendon, which is the back of the heel, into that calcaneus, or patellar tendonitis in the front of the knee, just underneath the kneecap, also known as runner's knee, or you can see it quadriceps tendon, which is above the kneecap, and then sometimes you can even see it on the side of the knee, on the outside of the knee, and that's that IT band or that IT band syndrome is what it's referred to. What happens with the tendonitis if it goes untreated, then it can come more into a chronic condition called tendinosis, which is actual breakdown of that tissue, which is more difficult to rehab and treat and get back into running. So when we talk about symptoms of tendonitis, first thing that we notice is some pain and some stiffness in that area, especially in the morning. So if you've been sleeping and staying stationary for one, long period of time, you'll notice a lot of pain and stiffness. You'll notice a lot of pain and stiffness at the beginning of your activity. So let's say, for example, you have some Achilles tendonitis, and you got to run without a proper warm up. So let's say you're running a 5K, the first half mile to a mile, you start to notice some pain and stiffness. About halfway through, about a mile and a half, you start to notice that it eases up a little bit. You don't really have any issues, and then maybe even through the end of your run. But then at mile 3, you start to notice that soreness, that pain come back, and that soreness and pain might linger around for the rest of the day or even into the next day. You also notice, pain and stiffness going up or down hills or stairs, again, increasing that load on those muscles. So especially if you're dealing with some patellar tendonitis, if you're walking upstairs, again, you're increasing the load on those quads, which is going to increase the load on those tendons, which is going to cause more irritation on there. It can be very point tender, so very tender to touch. So when you touch it, it causes some pain. It'll feel warm or swollen or puffy, and you can notice that, or you can notice that it could be a bright reddish color just from the inflammation kind of staying in there. All right. So the next injury we're going to talk about is not necessarily an injury. It's more of a symptom of an injury, but it's a very good indicator that something is not right with your knee. So we talk about knee instability. With knee instability, there's a lot of muscles, tendons, ligaments, cartilage, and other structures within the knee that help kind of maintain that stability. You have your quad muscles, your hamstring, you have your adductors, abductors. You have all calf muscles, soleus muscles. You have muscles that kind of attach at the knee that help with the ankle mobility that all attach in the muscles. You have your LCL, MCL, meniscus, you have your ACL, your PCL, patellar tendon, all that fun stuff. So there's just a lot going on in the knee that all contribute to that stability. An injury to any one of these components will lead to that instability. So what you'll notice, or even pain and weakness, at the hips or the ankles can cause some instability there. What you'll notice with that, so some symptoms of knee instability or having issues with that is you'll have some pain and point tenderness in that specific area. You might notice some swelling and pain within the joint. You'll have a feeling of the knee giving out. So if you're walking just at a normal speed or just normally what you would do and you just feel like your knee buckles, that's a good indication. You can have difficulty planting and turning. So if you're again, just walking and you go to turn around to talk to somebody and you notice like a give out or some pain with that, you'll notice that could be a good indicator. You also notice some popping and clicking with the knee, and sometimes it's not painful, which is okay. But if it's that painful popping and clicking within the knee, that's not a good sign, a good indication you could have something going on. And then again, difficulty walking up and down stairs. So even if you have like an injury to, let's say, the LCL, a ligament, the muscles kind of tend to work a little bit harder to maintain that stability because the LCL is kind of lacking. So those extra load on those muscles and tendons when you're going up and down stairs could induce some of that pain, that swelling, or just that knee instability feeling. Okay, so very similar to the knee, the ankle instability is there's a lot going on. So there's a lot of muscles, a lot of tendons, and then the ankle is mostly made up of ligaments. Now there are, like I said, there are muscles and tendons that attach through the ankle and at the foot and up into the knee that help maintain stability. But again, it's a lot of ligaments, and that's important here in a second. So weakness at the hip and the knee and the foot can create instability at the ankle. If you have some hip abduction, that any weakness that helps with that external rotation, it can cause valgus stresses at the knee, which in turn causes maybe a pes plantis type of feeling at the foot, which means your foot is supinated inward, which can cause issues at the foot, ankle, knee, hip, all that fun stuff. So any weakness at the hip or the knee or even in the foot can cause ankle instability. And that's important because any previous ankle injuries that you've had, so if you've, especially like for me, I play basketball, I've rolled my ankle plenty of times. Whenever that first ankle roll and I sprained those ligaments in my ankles, those ligaments never regain that stability, that elasticity that we want them to have, because they stretch and then they never really get tight again. So we have to work really hard to work the muscles in the ankle, work the muscles in the lower leg, even in the knee and the hip, to help maintain that ankle stability, to prevent further injury and to increase the ankle stability. Ankle instability symptoms include reduced range of motion, so you'll find it hard to dorsiflect, which is bringing your foot up towards you, or plantar flexion, which is pointing your toes. You can also notice some, range of motion deficits with inversion and eversion, which is just rolling your ankle inside and out. You can notice pain with activity, weakness with activity. You'll feel unstable running on even solid grounds. It'll get worse if you're running on uneven terrain. So if you like the trail run, you'll notice a lot of like pain and symptoms, tightness up through the lower leg and in the ankle. And then again, those tightness with the surrounding muscles definitely is a good indication of ankle instability, because again, like in the knee, the muscles really overhaul that stability roll when those ligaments get hurt. So, all right, the last instability that we'll kind of go over is in the hip, because they all are kind of connected. So the hip's a little bit different from the knee and the ankle in terms that the hip is more of a ball and socket joint. So there's a lot more mobility in the joint, which in turn reduces the amount of stability or increases the amount of stability that we need. It reduces the amount of stability that we have. And with the hip, you have a lot of muscles that attach in there and kind of work to increase that stability. So those need to be really strong to maintain that stability, but you also want good mobility with that as well. Weakness or tightness, any of these muscles can cause pain and instability at the hip. Here's a good kind of a picture here where you can see your glute max, which is that big, your butt muscle. You have your glute med, which is a good external rotator, good stability muscle there. And then you have all these other muscles here, which kind of lie underneath, which help, external rotation and overall hip stability. Pain and symptoms with, hip instability. So you'll have some consistent soreness and dull, achy pain after run. So this, you'll notice that, especially in kind of in the back of your, right where that glute med is, right where your butt is, you'll notice a lot of like sore and weakness with that. You'll notice some, again, tightness in that same area where it just kind of never really goes away. You can stretch it out, which might relieve some of that tightness, but as you continue to go again, and it might get tight again, you could have some sciatic pain or that nerve pain in the glute, or potentially shoot down in the back of the leg, even as far into the bottom of the foot. And then what you'll notice with the hip instability, which is a little bit different than kind of what we talked about, is the pain will increase while you're running. It won't ever really get better as the muscles fatigue faster, and as they kind of get weaker and tighter, that pain and that soreness and that dull achiness will get worse, and your running is going to decrease due to that. So you're probably wondering now, what is the best way to prevent, these injuries that we're talking about and continue to run at a better rate? And the answer to that is strength conditioning. Despite some popular belief or some, rumors or just stigmas that lifting weights is going to make you too big or too slow to run. And that's just not true. Lifting weights in tandem with running does improve your performance and decrease your risk for injury. Again, strengthening those hips, the knees, the ankles, and your trunk or your core is going to all contribute to running running better, improving that performance, and decreasing that risk for injury. Now, that being said, there is kind of a caveat to that. You do want to be very specific in your training. You don't want to go out and just power lift or weight train where you're just lifting super heavy weights, because that doesn't really translate into running. And the physiological responses from that is just different from the physiological responses from running. So you do want to be very specific. So if you not exactly sure exactly how to do that, maybe meeting with a strength conditioning professional or someone, personal trainer that could help you kind of find what fits best for you would be a good idea. Again, because that in turn is going to help improve your overall performance and decrease those injuries that you see, that we see a lot of times with runners. So there you have it. Those are the most common injuries we see with runners. Again, there might be different injuries that you experience that might be more personal, but again, these are the most common ones that we see here in the clinic here. So if you're having any pain, any of these sound like you that's preventing you from running, feel free to give us a call. Free 15-minute phone call with me or with Faith to help discuss any of your pain, your running goals, and how we can help get you there.